The United Kingdom is at a critical moment in the battle against coronavirus, according to Boris Johnson, who's warned that he won't hesitate to put further measures in place if necessary. And the government's chief scientific advisor has warned that hospital admissions and intensive care cases are heading the wrong way, as the number of reported new infections topped 7,000 for a second day running. The government has renewed the exceptional powers it gained in March under the Coronavirus Act, but only after promising MPs they would be able to vote wherever possible on new regulations before they come into force. And the Speaker of the Commons also warned the government against treating Parliament with contempt. As our political editor Laura Kuenssberg tells us now.
This is Sital. Coronavirus has changed her and her family's life. She and her husband both had the disease. His lungs are still scarred, and things are different now.
My husband was one of those people who, when COVID first came on the scene, he was a believer that it wasn't going to affect him. It wasn't going to touch him. He was under 45. He was fit and healthy, and it wasn't going to affect him. My husband nearly died, and it's really real. We found ourselves being more isolated at home.
And in that melee, Boris Johnson. Coronavirus has changed his life and his leadership too. Cases are rising again, political pressure mounting. Winter on the way.
No matter how impatient we may be, how fed up we may become, there is only one way of doing this, and that's by showing a collective forbearance, common sense and willingness to make sacrifices for the safety of others.
He can't say enough. He doesn't want another national lockdown, but it's plain it could yet happen.
If the evidence requires it, we will not hesitate to take further measures that would, I'm afraid, be more costly than the ones we put into effect now.
We can see today that the limits are already in place on millions of people have not stopped the spread, and you even had to apologise for failing to explain the rules properly. How can people have confidence in your government's approach, and can you give people your honest assessment? How high is the chance of more restrictions coming in for everyone, everywhere?
The answer is, I'm afraid, entirely dependent on how effective we are now collectively in driving down the virus. And we know we can do it because we did it before. Our success will have to be judged, I'm afraid, in the days and weeks ahead.
We've got a long winter ahead of us and a lot could happen over that time. So I think to predict forward from here would be a big mistake.
Numbers of cases are going up, hospitalisations are going up, ICUs going up, and unfortunately, very sadly, so are deaths. And that means that this is headed in the wrong direction. There's no cause for complacency here at all.
And the disease has changed the balance between ministers and MPs too. At the start of the epidemic, the Tories seemed the masters of Parliament. Now ministers have given ground to backbenchers who'll have more of a say over extra restrictions being rushed through. But not before a serious ticking off from the Speaker.
A total disregard for the House.
For cutting MPs who represent all of us out of the process.
I now look to the government to rebuild the trust with this House and not treat it with the contempt that it has shown.
And just as the Tory backbenches are proving less reliable than the government might hope, the opposition too is sharpening their attacks.
The government side of the bargain here is to have a very clear strategy for keeping that infection rate down, and we don't see that strategy. Very clear communications, and the byword for this week has been yet again confusion.
But even with the current limits, things are different for how the country makes a living too.
So this is the Business Design Centre.
This is Dominic Jones, the boss of this vast venue. Coronavirus has changed everything for him as well.
So normally it would be a thriving, buzzing environment with thousands of people.
These empty halls would normally be packed with 90,000 people a year.
This complete unclarity on people's futures, their livelihoods, is causing absolute distress. We have so many people that are allied to our industry, that rely on our industry. It feels desperately unfair that we are being told and targeted as a sector and simply told that we cannot open.
With rising cases come rising worries and rising concern about the government's grip. Everything feels different second time round. Laura Kuenssberg, BBC News, Westminster.
Let's have our nightly look at the latest government figures. They show that there were 7,108 new coronavirus infections recorded in the latest 24-hour period. That means the average number of new cases reported per day in the past week is 6,220. And as new cases have climbed, so have daily hospital admissions, with 348 people being admitted on average each day over the past week. That number does not include Scotland. 71 deaths were reported. That's people who died within 28 days of a positive COVID-19 test. And that means on average in the past week, 40 deaths were announced every day in this category, which takes the total number of deaths so far across the UK to 42,143. So as we know, the nature and extent of restrictions vary around the UK. It depends on the specific set of circumstances. There are a number of local and regional outbreaks, and ministers stress that people need to check what the position is where they live. At the same time, there are some measures which apply to everyone. There's the hands, face and space guidance, washing hands, wearing masks in shops and on public transport and keeping a social distance. And wherever people are, they should work from home if at all possible. Here's our health editor Hugh on just how critical a moment this is for the NHS and the attempts to control the virus.
Hospitals preparing for winter. At Southampton General, they've opened a new intensive care unit, and the Prime Minister set out the government's plans, a 4-month stockpile of PPE and thousands more ventilators for the sickest patients. But already the NHS is feeling the pressure. The number of patients with COVID-19 needing ventilators remained fairly low throughout August, but since the middle of this month it's been rising consistently, though at the peak of the epidemic the number was much higher.
We are receiving a picture of increasing pressure on the front line. So in some places the levels of COVID patients are going up and down. In other places they are doubling every fortnight, and in some places they are telling us that the pressure really is mounting.
Admissions to intensive care in England have risen sharply since mid-September, with the steepest increase for people between the ages of 65 and 85. Those who become seriously ill usually do so a couple of weeks after being infected with the virus. At this hospital, Royal Glamorgan in South Wales, 8 people have died after 82 coronavirus cases were identified. All non-urgent surgery has been suspended. Adults needing emergency care are being taken to other hospitals. To curb the spread of the virus, much will depend on testing in local communities. In some parts of the UK, people have struggled to get tests, with the system severely stretched. Here's what's been happening with testing since the end of August. The number of tests processed each day did rise through the middle of this month as demand increased, but it's been fairly flat since then. As for capacity, the ability of labs to process the tests, it did go up earlier this month, but at times struggled to keep up. It has gone up a bit more, though, in recent days.
What's worrying me about the COVID now is...
Care and nursing homes like this one in Yorkshire are still concerned they're not getting the service they need, with delays getting results back for residents and staff.
I would say the government's response so far is inadequate. We've got to do better, because testing is the key to solving this pandemic. We've got to test better. I'm still hopeful the government will learn and the capacity will grow.
People's behaviour is all important, according to ministers and health officials. They'll argue that scenes like this, an illegal party in a student hall of residence in Coventry, can only fuel the spread of the virus and potentially put more people in hospital. Huw, BBC News.
And just a reminder, to find out more about the restrictions as they affect you in your area, visit the BBC News website, bbc.co.uk/news/coronavirus. It'll take you to that section and the guides are there for you. Well, with around 1 in 4 people already living under tighter coronavirus restrictions and the prospect of more local interventions, how are people feeling now about the prospects for the coming weeks? Our political correspondent Alex Forsyth reports from Warwickshire.
This town is bracing itself for what may come. For now, Ulster's not under any local lockdown, but everywhere, signs that life is far from normal. At the High Street Deli, they made hot meals to help out at the height of the pandemic. For their business and well-being, they're wary about the next few months.
We're just anxious, we just don't know. We've got Christmas around the corner. We don't know if it's going to get worse or if it's going to get any better. I know that we will all come together again as a community and we will do what needs to be done.
This market town saw volunteers step up like so many places. And with fresh warnings about rising cases across the country today, they're prepared to do so again if needed. Sensing now emotional support might be in demand.
Back in March and April, everything kind of just felt like, the world was turning upside down. I think that there is probably less fear about the virus itself, but a little bit of fear about what the next 6 months is going to mean.
Hello.
Bill is certainly apprehensive. He was shielding with a lung condition, helped by local volunteers. He worries about new restrictions.
To be honest, I'm rather scared because, I don't fancy a winter of being shielded. But I think the country is much better prepared. The NHS, the supermarkets, although I still understand that, there's a shortage of toilet rolls already.
Some of the town's teenagers had a local community cooking class, are resigned to rules for the long haul, but it's not without frustration.
It just kind of annoys me because, they've ruined all the things we love. There's too many restrictions, but I'd much rather stay safe.
I'm hoping it goes well, studying for A-levels. I don't want to get schools to shut down again.
If we're in another lockdown over Christmas, I will be absolutely devastated.
There is uncertainty here, but for Paul and Joe, members of a bridge club unable to meet since March, it's a time to stay positive.
Optimistic.
We'll
optimistic
come through the
about
other
the
end,
distant
I'm sure.
future,
Yes.
if not the immediate future. I have my first grandchild on the way at the moment, so that's
Congratulations.
thank
Didn't
you.
know that.
Only found out last week. So it's something to look forward to, and life continues.
So despite having to keep apart, this community seems determined to stick together, knowing there could be tough times ahead. Alex Forsyth, BBC News, Ulster.
Well, let's take stock once again with our health editor, Hugh. Hugh, given what was said today at the news conference and what other experts indeed have been saying about these local measures and then more national measures across the UK, where do you think we stand now?
Well, Hugh, a couple of quite striking things, I think, from the media conference. First of all, Boris Johnson's statement, this was a critical moment. And what he meant was that it would still take time for the impact of measures to feed through. The rule of 6, for example, the 10 p.m. curfew on pubs and bars, other restrictions in different parts of the UK. Cases are going up, hospital numbers are still going up. So he said success or otherwise would have to be judged in the days and weeks ahead. That's a pretty significant statement. The other key point, I think, was made by Chris Whitty, the government's chief medical advisor, when he said this could be different from March. He said then the UK was rather unusual, with a uniform spread of the virus. In Italy and Spain, it was quite concentrated in certain areas, and they cracked down on them. He said this time, certainly in England, there was quite a concentration and an acceleration of cases and hospital numbers in the northeast and northwest of England in particular, and the Midlands. So he said, however difficult it might be for people in those areas, if everyone worked together, then the virus could be brought under control, given that localisation. But certainly measures in London haven't been ruled out. National measures, as we've heard, have not been ruled out either. And as Chris Whitty said, it was going to be a long winter ahead.
Hugh, again, many thanks. Hugh Pym there, our health editor.